Right. I think we have pretty much the number of people that they want to participate in this meeting. And I have to tell you at the bottom of my screen, once that it hits 1,000, you lose the sensitivity. It just says 1K. So I don't know what that number is. Good morning, everyone, and welcome. And I'm delighted to see the interest that there is in this discussion that we're going to have. Before we get started, I want to thank the entire faculty and staff for remarkable efforts that you have made to support our mission in all of its different components, whether it has been education, whether it has been research, whether it has been service, or of course, our clinical care under the most difficult conditions over the last 14 months. During this period, we have adjusted to the unknown, we have learned a lot, and we have overcome so many obstacles. And I know that I speak for the entire leadership team when I express how grateful we are for your efforts. In my first communication to the campus in early March of 2020, at a point that I didn't know much about the disease, but I was anticipating its effect on our future. I pointed out how important it was to place our trust in science and to work together. And once science started delivering results, we developed the appropriate safeguards for our gradual, safe return to campus last summer. We also depended on the entire community to follow the safety protocols that we put in place. And because of your compliance with these protocols, and I have to highlight this, the students' compliance with these protocols in the fall and the spring of these academic years, we have been one of the safest places when it comes to COVID-19 in the city and across the country. Our trust in science was well placed because science also, in a remarkable development, has delivered outstanding vaccines in record time. So here we are today, preparing for a return to undergraduate face-to-face instruction in the fall, as every other university does, in the city, the state, and across the nation. The vast majority of our students want to return to normal because of the value they place in their interactions with each other and in their interactions with you. This is not a reopening of the campus, and I have to be clear of this. It's not a reopening of the university. Of course, UA Health and our colleagues at UA Health were always at their posts, even at the very worst cases in the pandemic, and now they're back at full scale. Our dorms were open. Our dorms were open last spring, and they were open last fall and this spring with thousands of students. Our student affairs staff supporting these students, our custodial staff, our facilities management staff, our public safety officers, they were at their posts through the entire period. Our healthcare professional students in dentistry, in medicine, in pharmacy, in nursing have been receiving face-to-face instruction since the beginning of last fall. And our bench researchers, whether they're staff members, their faculty, and many of our graduate students in the STEM fields, they have been in their labs since last summer. But of course, it is a step change when we're talking about the return of a large number of undergraduate students in the East Campus and the professional students in the law school in the Loop, and all the faculty and staff that are needed to support these students. As you will hear today, we are putting significant plans in place for a safe return, and the various vice chancellors that they are involved, they're going to give you more details, and they're going to answer to the questions that you have already submitted and other questions that they will be submitted through this process. Before we get to them, I want to repeat the same ask that I had from the entire community in March of 2020. I'm asking you to place your trust in science, follow the safety protocols, and contribute to the creation of a safe environment. And also, place your trust in science. Do not succumb to fear and conspiracy theorists, and get vaccinated against COVID-19, as I did and my entire family has done by now. This is the only way to beat this virus and reclaim our lives. I think the next speaker that we have will agree with my assessment of the vaccines. Professor Susan Bleasdale is the medical director of infection prevention and control at UA Health, and she will talk about these measures. Susan, the virtual podium is yours.
Thank you, Chancellor. So yes, I am one of the infectious disease physicians here. I've been helping the hospital with our COVID response, but also the campus as well. And as the Chancellor highlighted, we have created a safe place to work, and we have continued to have activity on the campus throughout the pandemic. And we are excited that as we have increasing vaccination and decreasing numbers of cases, that we'll be able to even expand more activities as well for the campus. We continue to follow the guidance of the Department of Public Health to make sure that we have a safe environment. You may be hearing about a lot of opening activities within the city of Chicago and across the country. But again, we continue to follow the guidance for capacities and masking and distancing that's required. Currently, outdoor masking, you may have heard, for those that are vaccinated, you can take off your mask. However, there is a nuance to that recommendation. When you're in public places such as schools or workplaces where the vaccination status of those around you is not known, it is still recommended to continue to mask and keep your physical distance. As we adapt and change, as guidance changes, we make sure that if we make changes to our recommendations, we do that safely with the right precautions. So right now we are continuing to mask on the campus, and we are continuing to keep our physical distance. This may look different in the fall or in a short period of time as we have more decreases in the number of cases. But for now, we continue what has been a successful program thus far. As the Chancellor mentioned, we have had a successful year since the pandemic has started. We have a health system and much of the health science colleges that have remained on campus for patient care, research, and education, and have had students in housing, athletics, and performing arts, and we have done this safely. We do know how to keep people safe in relation to this pandemic. Masks work. We were the first to implement universal masking in the city and actually in our region as well. We have not seen the same numbers of cases that other campuses had seen in our fall as we brought students on campus for campus housing. We've reviewed all of our buildings and our activities for safety precautions and capacity limitations. We have our own contact tracing teams for our students and for our employees, so we can very rapidly identify cases, notify people if there is any potential exposures, and guide them for testing and quarantine as needed. We have not seen transmission on the campus related to the classroom activity, and this is very reassuring because this reinforces what we've been able to do to create a safe environment. Primarily, cases have been related to outside exposures and social activities. Meal times continue to be a high-risk activity. That's really where people tend to gather closely. They take their masks down, and this is still a high-risk activity. We continue to provide quarantine and isolation housing for our students as well, and facilitate testing and meals to make sure that they have a safe environment. We have multiple tools, and these continue to be our tools to keep a safe environment for the campus at large. We have our masking, we have our distancing, we also have testing. We implemented saliva testing initially for a small group, but then have expanded it campus-wide and even to the hospital setting as well. We have done over 250,000 tests, and this allows us to identify individuals early and help to guide isolation to prevent subsequent transmission. We are continuing to evaluate the need for the saliva testing in those that are fully vaccinated, and we're evaluating the data. Vaccination is really important way to protect you and to protect others, but we want to make sure, as nothing is 100% effective, that we're capturing anyone with vaccinated breakthrough disease to make sure that they're isolated quickly, but likely will not need to continue that long term. Testing continues for anyone that is symptomatic, either through our employee health or through our student health services. So if anyone is concerned that they may have COVID-19, we have testing available, and we also have treatments available for anyone that would like to seek care here at UI Health, and help to treat them even in the outpatient setting to prevent the risk of hospitalization or death with treatments. We have a health check app to make sure that we're evaluating your symptoms. It's also linked to your saliva testing, so we can know that we have a safe environment when you're coming on campus. And again, as I mentioned, we have our contact tracing team and a safety committee that evaluates all of our areas. We also have a website that's available that shows our COVID performance. It gives kind of red, yellow, and green light to let you know what's happening in the community and what's happening on our campus. And again, we're currently in a green status because of what we are doing to create a safe environment. All of these tools are helpful. And now we do have an additional tool, and that's vaccination. UI Health, through collaboration of the campus, has given over 122,000 doses of vaccine. So far, this has been primarily through our vaccination offering at the Credit Union One Arena. This is where we've been able to give a large amount of vaccines quickly. We started with healthcare workers and then moved to our faculty and staff, and then we have been able to offer it to our students as well. We also have offered vaccination to our enrolled students. We highlighted this at our enrolled student town hall just recently, and we've also provided information for those students to be able to get vaccinated now if they're in the area or when they come for orientation, so that we can ensure that we've offered vaccine to everyone that's on campus. Vaccine is offered at no cost to anyone, to our patients, to the community, to our faculty, staff, and students. We also have information so people can make an educated decision about getting vaccinated. We have at our website, it's vaccine.uihealth.care, is where we provide how you can get signed up to get vaccinated, or for faculty, they should have received an invitation through MyChart to be able to get scheduled. We have frequently asked questions so you can understand what the questions and dispel myths about the vaccines that are currently available. The vaccines that are currently available are Moderna, Pfizer, and Johnson & Johnson. These are, especially Moderna and Pfizer, are safe and efficacious. There was a pause for the Johnson & Johnson, and there is a small potential risk associated with the Johnson & Johnson vaccine in those that are age 18 to 49 for a possible immune clotting disorder. It was a risk of 7 in 1 million for that age group. And then after 50 years old, it is 0.3 per 1 million. So very low and similar to other medications and other disease processes, very low. However, the risk of clotting from COVID-19 is significantly high. And so it's important that you choose to get vaccinated and choose which vaccine you'd like to be vaccinated with. There are many questions about whether there'll be requirements for vaccine. Right now, we are focused on encouraging vaccination. Vaccination may impact our capacity, but at this point, it doesn't change our current practice of distancing or masking requirements at work. We are not excluding anyone from participating in on-campus activities based on their vaccination status, because we have adequate safety measures to allow everyone to be on campus that needs to be, so that there isn't a requirement for vaccination at this point. There is some review of whether or not we would require vaccination and disclosure of your status, but the chancellor might want to make a comment on that as well. And I think as we follow up, I think the other questions that we have been about international students as they are arriving, whether or not we'll require vaccination. Again, we are not requiring, but we are encouraging vaccination. We will offer vaccination for any international students when they arrive, depending on the arrival from the country where they're coming from or their vaccination status. That may impact any testing or quarantine requirements. And we do have quarantine housing available as needed for those students that would be living on campus. Chancellor, I see that you came back on the
Yeah,
camera.
and the issue of vaccination has come up especially because a number of universities across the country have declared that they are going to be mandating vaccination of students, and in a couple of cases of employees as well. For the public universities in the state of Illinois, we don't have the authority to require such vaccinations at this point. But we are considering all options, and we're working with the state to see how can we address these legal and regulatory framework issues in order to give us the option to require vaccinations as well. The few institutions that you have seen in Illinois requiring vaccinations are private institutions that they believe they're in a separate category than we are.
Thank you. In addition, there's been questions about travel, and I want to highlight for travel in general, we ask that you notify the campus for guidance on testing and quarantine on return, because this changes very rapidly based on what's happening in different areas of the country and outside of the country. There's an approval process for essential business travel, and it's recommended that you submit for any travel that's anticipated within 3 months. It's very hard to anticipate what's going to be happening in 6 months or a year from now, but there is a process to review anticipated recent travel within 3 months that will help to guide pre-travel plans and any post-testing quarantine related to requirements by location and the vaccination status. Although many have heard CDC has made a statement of the possibility of international travel to be okay for those that are fully vaccinated. And again, fully vaccinated is completing a vaccine series, and it's been at least 2 weeks. But there is specific guidance by country, and there are many countries that are considered what is called level 4, which is very high ongoing transmission. It's actually about 80% of the countries currently outside of the United States. And at this moment, even essential travel is not advised to these areas. This may change, and we're hopeful with more vaccination and control of the pandemic globally, we'll be able to expand travel and other activities. There's a similar process for review of UIC-sponsored activities. And so these are other activities to make sure that beyond the normal space and evaluation of our day-to-day activities, but any additional UIC special activities, that there's a review of how this is going to be in place to make sure that we're maintaining our distance, our masking requirements, and our capacity as recommended by the Department of Public Health. And so all of these processes are in place to help us to have a safe environment here on the campus and to continue our activities and to continue to expand our activities. So I will finish now and now turn things over to Provost Susan Poser to speak on other issues as well. Thank you.
Thank you, Susan. Good morning, everybody, and thank you very much for being here. I want to first start by reiterating what the Chancellor said, and thank you for all of your incredible hard work over this really challenging year and your resilience. I think we did very, very well as a university, and it's now time to move forward. So I'm going to talk a little bit about fall 2021 classes and academic planning and try to address some of the questions that have already come in over the past week. And I want to preface this by sort of reiterating what Dr. Bleasdale said, which is that all of this is subject to change. The protocols are very likely to change as summer progresses, as long as people continue to get vaccinated and the public health outlook improves. So fall is really going to be a transition semester. We won't be done with COVID, but it won't be as bad as it has been in the past. And so there will be continued remote learning. This is also a time to plan ahead as to how the campus should handle curriculum delivery and other activities at the university in the future when public health no longer has to guide all of our decisions. So what I'm going to talk about mostly is the general plan for undergraduate courses. And much of this I think you know already. All courses with more than 100 students enrolled will be online, synchronous or asynchronous, and that's up to the faculty member. There's an additional small number of classes with fewer than 100 students enrolled They will also be online because these classes were requested by the deans and were given permission to be online along with those classes that are over 100. Everything else will be taught on campus. Now, currently, there is still the requirement for distancing at 6 feet. And that means that in most classrooms, approximately 1/3, and in some cases, even fewer or less of the class can be in the classroom. So while the students that are there on that day are live, other students will be able to watch the class synchronously online. If the distancing requirements change, which we all hope that they do, and for example, go to 3 feet, more students can be in the classroom. Then it would be much closer to 50% of the class. And maybe in some cases, it would be 50% of the class can be in the classroom at the same time. They are going around, Vice Chancellor Coronado's unit has people going around and putting in dots for 6 feet of seating in the classrooms and for 3 feet, so that if we hear that we're going to 3 feet, it will be very easy to utilize those classrooms right away. They're already set up for it. Faculty who are teaching synchronously online must meet at the time that's indicated on the class schedule. So they must hold their class during the time as if they were in the classroom. Even though they are assigned to online, their classrooms will be saved and can be used by the faculty member for small group review sessions or even exams. And there will be options for on-campus exams for synchronous classes. These are being looked into now by the Office of the Registrar and class scheduling, and there will be more information about how those can be scheduled later. The current rule, as you just heard, is that everyone is required to wear masks indoors at UIC. That is expected not to change by August, so that students and faculty will be required to wear their masks in the classroom or in the lab. We are also now looking into purchasing plexiglass shields for faculty standing at the lectern. And we expect them to have them in all of the classrooms in August. And this will allow the faculty member to take off their mask while they're teaching if they stay behind this plexiglass shield, which I think will be better for recording purposes as well. We are adding technology to all of the undergraduate classrooms. The ones that can accommodate Echo 360, which is a system that we already use in many classrooms, will get Echo 360 installed. Others will have equipment in the classroom for streaming and recording. Some of the type of equipment depends to a large extent on what can actually be put in those classrooms. You will hear more about this in a few minutes from TJ Augustine. I strongly urge faculty to record classes for students who cannot attend and may have trouble synchronously following the class on any particular day. This is not a requirement to record, but it would be a very good thing to do it. Now, I got questions about students getting excuses to not come into class when it's their turn to be live in class. Generally speaking, students do not need a medical or other excuse to not come to class on campus. They're going to do what they want to do, even if and when faculty set expectations about who's supposed to come in on what days. I believe that there will be enough students who do want to attend class to make this rotation possible, even though maybe not every student will come in every time they're supposed to be in the classroom. If you find yourself teaching to an empty classroom on a continual basis, you should go in and talk to your department head and figure out what to do. Again, it's very hard to say right now exactly what should happen in that circumstance, but it is something that may have to be dealt with at the local level. I obviously will not be here policing this, but I don't think that the interim provost or your next provost is going to be policing this. These are issues around the edges that just have to be dealt with at the departmental and the college level. Now, having said this, there are some faculty who are requiring attendance online on the days when the student is supposed to be there. I've heard that this is happening in some laboratory classes and possibly some classes in the fine and performing arts. It is within the faculty's prerogative and discretion to make this a requirement. It's just very important to make it very, very clear on the syllabus that this is true and that they must be there, and it's not simply an expectation. I also want to mention that we are returning to the regular grading policy beginning with the summer session. If you recall, when we set the grading policy for last fall and this spring, and the change was that for D's, the letter grade D, students got a credit, and for the letter grade F, students got a no credit. Those will now return to D and F beginning in the summer. Those were exceptions to the regular grading policy, and it was very clearly stated at the time that they would apply in the fall and the spring. So when spring is over, we're going back. Now, I've been talking about undergraduate students and undergraduate classes. As far as graduate and professional courses go, those are being decided, that their modality is being decided, whether they're on campus, remote, synchronous, asynchronous. That is all being left up to the individual colleges and departments for graduate and professional education. So those are the things that I wanted to cover today. I look forward to hearing your questions. And now I think I am passing it on to TJ Augustine. Okay. Thank you.
Thank you, Susan. Great to be here, everyone. This is TJ Augustine, Vice Chancellor for Innovation. I wanted to follow up on the Provost's comments to talk a little bit more about the technology that we're working to deploy to support teaching this fall. Over the last month or so, we've launched a major project to deploy technology to more than 500 classrooms and learning spaces across the entire campus to support hybrid teaching. Right now, we're prioritizing upgrades for rooms that support undergraduate education so that those rooms will all be upgraded and ready for fall semester. But we will upgrade as many teaching spaces as we possibly can, including some that do support graduate education on both east and west sides of campus. As the project is started, we've been working to focus on spaces where we will have the greatest impact. That means we have, at this time, been prioritizing lecture and seminar rooms that are large enough in size to most benefit from the technology. Those are spaces that are roughly 500 square feet or larger. That said, I'll reinforce that all learning spaces, regardless of size, are under consideration, and we will complete as many as possible. The technology to support hybrid teaching this fall will include a number of things, including lecture capture and live streaming, with the room upgrades, including lecture capture equipment, cameras, microphones, speakers, and more. As the provost said, we will deploy Echo 360, which is already rolled out through many of our rooms at this time, in as many rooms as possible. But ultimately, the technology in each room will depend on the specificity of that room. We're upgrading outdated equipment as well. As many of you know, there are projectors in rooms across campus that may not be ready to deploy with the technology we are rolling out, and we will be upgrading those systems as well. In addition to the AV equipment, we are upgrading networking capacity in and around these classrooms as well. We don't want to be in a position where we deploy new teaching technology that overwhelms the network and therefore can't be effective. So the technology solutions team is already working hard in and around these spaces to make sure they're well connected from a hardwiring or wireless standpoint. I want to take a minute to remind everyone that this is a big and complicated project. Our technology solutions team has traditionally only supported 180 common use classrooms that many of you are familiar with on East Campus. We've now added more than 300 rooms across the university that LTS is now supporting in collaboration with college IT staff. This includes 190 classrooms managed by the colleges on East Campus and about 140 rooms managed by colleges on West Campus. We've had great examples of partnership from engineering, LAS, College of Business, and now all of the health science colleges. I really want to thank them for their responsiveness and flexibility thus far, and hope we continue to have a great working relationship with them and all of the other colleges across campus. In addition to the new technology I've mentioned, we expect to use the full set of software that we've all become very familiar with since last spring and summer, including the Blackboard Learning Management System, Echo 360 for lecture capture, Zoom, Panopto, and many others. Overall, we're very confident that we'll have all the technology we need to enable faculty and students to succeed next fall. But ultimately, the success of this project will require continued teamwork and coordination with every college across the university. And I expect to see more examples of the great partnership we've already seen as the spring and summer unfold. We also know that we will need additional support for our faculty as they adapt to using new technology that they may not be familiar with. We are going to begin the process of hiring students to support faculty in these efforts and help with training in the very near future, and expect to learn more about that as we move into the late spring and throughout the summer. Very specifically though, next week on May 13th and 14th, the Kate Summer Institute kickoff will take place. This is going to be a great opportunity for instructors to learn more about technology in the classrooms, and registration is available for that event now. The last thing I'll mention is something that's very critical for our students. Since the pandemic began, Technology Solutions has been running a laptop and hotspot program for students that don't have access to their own laptop or internet connectivity at home. This program will continue next fall, and we expect it to continue until there is no longer a need for this program at some point in the future. I'll stop there, and thank you for listening, and I'll turn it over to our Vice Chancellor for Research, Dr. Joanna Groden. So you're muted, Joanna.
Thank you, TJ. I'd like to welcome everyone back to campus, especially all our researchers. Research has been open for many months now, working safely and accomplishing great things. We have so much to be proud of in our research accomplishments. I'd like to extend special welcome to our new and returning undergraduates who may have interest in research. Our laboratories and researchers await you. Similarly, we are very much looking forward to receiving new graduate students and postdoctoral fellows who will be joining us throughout the summer. We encourage all of you to contact Dean Colley, Dean Keene, your faculty, mentors, and professors in order to join some of our research programs. And there are so many choices, so many questions ahead. I think if we've learned anything during the pandemic, we must see that there are so many questions left to be answered. And we should have great enthusiasm about welcoming and training the next generation of scientists, clinicians, and researchers. There are so many questions that are important for us to begin to address, both in terms of racial equity, health disparities, infectious disease, so many other areas that await the next generation. And our faculty and other research staff are waiting, they're joining us. I'll tell you again, we should have great pride in the accomplishments of the researchers who have worked so diligently throughout the pandemic. We have also celebrated great accomplishments in our research portfolio. At the end of fiscal year 2020, we had a more than 7% increase in our research awards. And in the year to date, we are already 8% above last year's accomplishment of breaking 400 million in research awards. So again, I give tremendous thanks to all our researchers who have very steadily addressed all these new questions and opportunities in research. And I will also give many of you a heads up that the federal budget looks to be very generous in the next year or years for research. And already many of you who are busy working have shown us with 14% increases in our proposal volume for research that you have many ideas and data that should compete very successfully in the year to come. Again, I think much of this research funding will be directed in areas of health equity. As we've learned, this is a tremendously valuable area for us to address, to learn how to provide good health care to all. There's also great opportunity for research in infectious diseases, therapeutics, drug discovery, and we have much to look forward to learning about climate research, energy storage, material sciences, and I could go on and on. Lastly, I will tell you that we need to be very grateful for all those who worked steadily throughout the pandemic. I think our clinical trialists, our clinical researchers, and population health researchers have done such a fantastic job with taking care of others in our community and people within our community. And we're very grateful to them for their very hard work. I'm very proud of the graduate students who defended their theses during the time of the pandemic, and also the graduate students and fellows who continue to do good work with their mentors and advisors all across the campus. I would like to thank certainly our research core scientists and our vivarium staff for also supporting the researchers, and as well as so many of the workers in my office, in the OVCR and the environmental health and safety office staff. They've done tremendous jobs to make our laboratory and research spaces safe for everyone to continue to work and to join the research teams that are continuing to answer important questions. I'll remind you that all areas are open for business: clinical and human subjects research, community-based research. Our field workers are beginning to rejoin their projects throughout the US and as well as in foreign countries, with some exceptions still. All our bench laboratories are very hard at work, our wet and dry spaces, and we are very much looking forward to seeing our scientists and our trainees begin to attend national meetings and international meetings in the months and years to come. So let me add to my colleagues' welcome to you. It is safe. We have done great things in the last year, and we look forward to another fantastic year. I will now turn the podium over to my colleague, Vice Chancellor John Coronado. I think one of our real heroes during the last year. He kept us safe, as did his staff, and so many of our buildings and programs. So John, here it is, your turn.
Thank you very much, Joanna, for those kind remarks. Good morning, everyone. I'm John Coronado, the Vice Chancellor for Administrative Services. Let me start off by giving a big thank you to the administrative service units, our personnel that have been working tirelessly throughout this pandemic, coming to campus on a daily basis and performing their jobs and Herculean tasks and keeping our campus safe. And with that, I want to reiterate what the Chancellor and others have said. Our campus is safe. Our policies, procedures, protocols to date, as well as our planning for fall, has been and will continue to be informed by science, along with the CDC and public health recommendations. Some of my remarks will repeat some of the key items because we've been working so closely with our health professionals, along with the academic and student affairs personnel, to ensure the continued safe operations on campus. From an operational perspective, it's important to understand that, as the Chancellor said, campus operations never fully ceased during the pandemic. Healthcare, critical research, health science, academic instruction, public safety facility operations, and housing never stopped. Our saliva testing and contact tracing programs have proven to be instrumental in quickly identifying cases of COVID and getting the people into isolation or quarantine. Let me share some statistics. We've completed about 150,000 saliva tests. The surveillance testing of the people who routinely come to campus since last August has a positivity rate of 0.8%. And the average time for the approximately 1,200 COVID positive cases that were identified through the saliva test program to get those individuals into isolation is about 3.1 hours. Also, based on our contact tracing investigations, we can confidently say that there have been no known COVID transmission cases in our classrooms. We're confident that our campus spaces will continue to be safe because we have multiple layers of protection in place to keep COVID-19 off our campus. And if it does show up, we quickly address the situation. Let me talk about these layers of safety. First and foremost is the vaccine. There's ample opportunity for anyone desiring a COVID vaccination to get fully vaccinated. If you haven't been vaccinated, I strongly encourage you to get vaccinated. It's your best protection. UIC Health Check. We will continue emphasizing that anyone exhibiting fever or not feeling well should not come to campus. Our UIC Health Check program requires anyone coming to campus to complete a self-attestation that the individual is not symptomatic. Saliva testing. We expect that periodic mandatory surveillance testing will continue in some fashion. The exact testing parameters, which may include exempting vaccinated individuals from testing, will be informed by the prevalence of the virus and the rate of infection. Our badging program. The combination of UIC Health Check and saliva testing compliance badging will continue. You may be expected to show your badges to verify compliance prior to entering academic buildings. In fact, we're planning to hire student public health ambassadors to confirm health check and saliva test compliance prior to entering academic buildings. The masking requirement. We expect that wearing a mask while indoors will still be required throughout the academic year. Science has proven that the wearing of masks is the single best way to protect yourselves and others from COVID-19. Distancing. Current CDC recommendations remain 6 feet, but we're preparing for 3 foot distancing in classrooms and labs, similar to K through 12. And this assumes that either that CDC or public health will announce this adjustment prior to the beginning of the semester. And we can quickly pivot to that. Hygiene. Hand hygiene will continue to be emphasized and sanitization stations will be plentiful around campus. Wipes will also be available, and we also recommend that students and staff carry their own personal size bottle of hand sanitizer. Now let me address how we are mitigating the risk of COVID infection spreading on our campus. We've been working hard to create and maintain safe spaces. Utilizing CDC recommendations, we created COVID safety plans for all our buildings. These plans and actions address building heating and ventilation, air conditioning, and water systems, cleaning and sanitization standards, spacing and configuration protocols to create required separation between individuals, and installation of barriers, signage, hand sanitizer, and wipes where appropriate. You can expect remote work opportunities and modified on-campus work schedules for employees to reduce congestion and density. Dr. Ginsberg will provide more details in his remarks in this regard following me. Most buildings will continue to remain locked with card swipe access only. Some buildings may also have designated entrances and exits, and general use classrooms, libraries, student centers will remain unlocked during normal hours. Elevator areas, stairwells, and restrooms have signage to reinforce health and safety practices. Sanitizer and disinfectant wipes are readily available near entrances, elevator lobbies, in classrooms, conference rooms, break areas, and open work areas. As I said before, a minimum of 6 foot spacing will be maintained in classrooms. Where possible, furniture has been relocated. Sit here stickers will be placed on chair backs to signify available seats. Sanitizer and wipes will be readily available for faculty and students to use for their seating and work areas. And we're prepared to pivot to 3 foot spacing when authorized. We will be erecting 5 all-season enclosed air-conditioned tent structures around the campus to provide additional locations for students to study or stream classes. 4 of these will be on East Campus and 1 will be on West Campus. Additional cleaning responsibilities for faculty, staff, and students including conference rooms, shared workspaces, collaboration spaces, break rooms, kitchenettes, and coffee stations. Cleaning supplies, wipes, and hand sanitizers will be readily available so those areas can be maintained. Building service workers will continue to clean all the spaces that have been cleaned in the past. They will disinfect frequently touched surfaces multiple times per day and provide daily cleaning of classrooms. A late night work shift has been established to assist with the daily cleaning and periodic disinfecting requirements. Our building service workers will also weekly deep clean classrooms, restrooms, and elevators using electrostatic spraying process with hospital grade disinfectant. This deep cleaning capability will also be employed in any space where there may be any COVID exposures. And all of what I discussed in terms of spacing, cleaning, and sanitization also applies to our campus transportation services. This includes our buses, night ride, and paratransit vehicles. I'll wrap up my comments by talking about indoor air quality or the ventilation concerns. There's been numerous questions about that. First, let me start by saying that the CDC recommends that higher ed institutions follow the American Society of Heating, Refrigeration, and Air Conditioning Engineers guidance for reopening buildings. We have been and will continue following this guidance for all our campus buildings. Specific guidance includes ensuring system evaluation for issues in compliance with design requirements, inspection and maintenance to verify systems operating per design intent, ventilation and filtration, confirming that systems provide the required minimum amounts of outdoor air for ventilation, and filters are MERV 13 or better for recirculated air. Conduct pre and post occupancy flush with outdoor air, and to identify buildings that require increased outdoor air ventilation, improved filtration, and/or air cleaning technologies. Now, I acknowledge that we do have lots of aged buildings and systems along with significant deferred maintenance, but I can say with certainty that we have had no reported indoor air quality issues prior to the pandemic that have not been addressed. We have and we will continue to respond quickly to investigate any reports of indoor air quality concerns. Our campus will be less dense than prior to the pandemic. And going back to the beginning of my remarks, we have controls in place to keep the virus out of our facilities. We will continue to require the wearing of masks while indoors. Let me cover some data now. We have 452 air handling units at UIC, plus another 910 unit ventilators. Within our facilities management unit, we have 96 plant operating engineers whose job it is to ensure that these systems and ventilators are operating correctly. And they do a fantastic job in keeping these systems operational. They perform preventive maintenance on the units, checking and changing of filters and belts, lubricating bearings, cleaning coils, checking plenums, dampers, louvers, and valves and seals. They also know how much cubic feet of air is being supplied by the systems, along with the percentage of fresh air that's coming into our buildings. In short, their job is to ensure that our HVAC systems are operating optimally. Again, much of the university never shut down during the pandemic, and our engineers have continued to operate and maintain our heating and ventilation systems in accordance with the CDC endorsed ASHRAE guidelines. The majority of our spaces will be operating with reduced capacities, and where localized problems are identified, we will either make additional adjustments to capacity or introduce additional HEPA filtration or other air cleaning technology. We intend to be transparent with our ventilation assessments, similar to what we did at the beginning of the spring semester, with classroom spaces results posted on the facilities management website and also announced in the Circle Back to Campus newsletter. This concludes my remarks. Thank you very much for your time. And now I will turn it over to Dr. Michael Ginsberg.
Thank you, John. Good morning. I would like to discuss the telecommuting and remote work policy, which we distributed earlier this week. As you heard the Chancellor say, and many others, our goal is to get everyone back to the campus consistent with the prevailing health advisories issued by the city and the state, depending upon your physical location. First, it is important to recognize that there are many jobs at UIC that cannot be performed remotely. They may be student-facing, facilities-related, and/or require interactions with the public, other employees, or patients. And as many people have talked about earlier this morning, many of these employees have been working on site and will continue to do so. However, as we transition back to the campus, the new policy is intended to guide the deans and vice chancellors to approve remote work, whether on a rotational schedule, where employees may alternate in or out of the office, or to address emergent situations during which an employee could be approved to work remotely for a limited duration. Each vice chancellor and dean will determine how this policy will be implemented for their units. There may be some employees who must begin coming in prior to the start of fall semester so that they can be prepared for students. These reasons are determined by the management of your college or unit based upon their operational needs and/or space constraints. Therefore, any specific questions are best addressed by your unit. Of course, keep in mind that many of them are still determining their specific strategies and procedures for this. Nonetheless, approval of a remote work schedule must be equitable for similarly situated employees in like jobs or responsibilities. And I want to reiterate that this policy does not apply to faculty. In conjunction with release of this policy is guidance on the establishment of flexible work schedules that could also result in the staggering of employee arrival and departure times, and/or with alternating days in the office to reduce density and space needs. If you are authorized to work from home on a rotational or regular schedule, there will be a form stipulating the requirements and expectations as executed between you and your supervisor. The authorization of such agreements is not a right and can be revoked at any time by management. The policy also indicates that the university will provide equipment and supplies sufficient to allow you to work effectively from home. However, we are not required to provide internet or phone service. If there is a medical or disability reason for you to continue to work from home, employees must follow procedures from the Office for Access and Equity to determine whether an accommodation is appropriate. Further guidance will be made available in the coming weeks on this. I will conclude my remarks on the remote work policy by reminding you that the policy and associated documents are available on the UIC Human Resources website and also under a new tab on our website under the COVID Road to Recovery page. Thank you.
Thank you, Michael, for sharing those details about the remote work policy. Hello, everyone. I'm Sherry McGinnis-Gonzalez, Interim Vice Chancellor for Strategic Marketing and Communications. We've come to the end of the panelists' presentations, and we will now open discussion to your questions. I want to thank everyone who took the time to submit questions in advance. We hope that you've received many answers to many of those questions during the presentations today. And while we are taking the time to answer some additional questions, you may also submit questions through Zoom, and we will do our best to respond to as many as possible during our remaining time today. We are going to start with a question for Chancellor Amaritis. Chancellor, will staff who do not feel safe returning to and commuting to campus be allowed to continue to work from home? What kind of documentation, if any, will you require from them? And will you ensure that documentation is not overly invasive or punitive and instead supports the well-being of the university's employees?
I think Dr. Ginsburg outlined clearly what are the procedures for somebody to work from home. There is a process for individuals, whether they're staff members or faculty members, that they may need specific accommodations, and I expect that this number is going to be relatively small, given what or very small, given what the health experts are telling us about requirements and about how safe is the campus. And the second possibility is somebody that does not need to be on campus and whose direct supervisor in the administrative structure agrees to provide the opportunity to work remotely. The way that the question is phrased, Sari, about feeling safe, what the type of the exceptions we're going to make are not necessarily based on feelings. They're based about the need to be safe and the type, or alternatively, the type of the position and the work that somebody does on campus.
Thank you, Chancellor. The next question we're going to ask is for Dr. Bleasdale. Dr. Bleasdale, will the health screening and saliva tests continue during the fall 2021 semester? And will UIC waive COVID COVID-19 saliva testing requirements for students and employees who can show they are fully vaccinated?
So likely, yes, we'll continue with the health screening and the saliva test because we anticipate that COVID-19 will still be with us. I think that's a good question about whether or not we'll exempt those that have been fully vaccinated. Right now, we are continuing to test those that are fully vaccinated, and we will evaluate the data. We will review the prevalence and determine whether or not that will be a continuing test or an exemption in the fall. So there is more to come as we have more data and evaluate that moving forward.
Thank you, Dr. Blaisdell. And the next question is for Michael Ginsberg. Some UIC departments are giving their employees 4 hours time off to go and get the COVID vaccine, and others are making employees use vacation or sick time to get the vaccine. What is UIC's policy on this?
Thanks, Sherry. Our policy is guided by the American Rescue Plan Act, actually, which initiated as of April 1st a couple of new guidelines that allow for time off. So an individual can utilize American Rescue Plan Act time to get vaccinated. They can also use time off if it turns out that they have a reaction after the vaccine and need to miss a day or two of work. Employees have the option to use their sick leave time if they'd like instead of that time, but that time affords them to be able to not have to use their sick leave time and to use the American Rescue Plan Act. And again, for the American Rescue Plan Act they followed up on the Families First Coronavirus Response Act, which allowed leave and has been extended now through September 30th.
Great, thank you. Our next question is for John Coronado. Prior to the pandemic, I used public transportation to get to work at UIC. If I decide that it's not a safe option for me to commute and I drive my own vehicle, will there be large parking fees to park on campus?
Great, thank you for that question. First, let me make a comment about public transportation. Many people have been coming to campus throughout the pandemic via public transportation. It is safe. They employ, both Metro and CTA employ similar protocols and controls to keep the passengers safe. And our contact tracers have not reported any known cases of virus transmission on public transportation. That said, if you do decide to drive and park in one of our parking lots or structures, we will continue to allow the daily parking at a reduced rate, and that rate will be comparable to the cost of public transportation. The details for our parking rates is still being developed, and we expect to make an announcement regarding the rates for the upcoming academic year in late June or early July. Thank you.
Thank you, John. And the next question is for the Chancellor. Will it be possible to get a general salary increase this year? And no, I did not plant that question, Chancellor.
And I assume this question is directly related to COVID-19 and our plan to return to face-to-face instruction, right? Look, despite the financial issues that we have faced over the last year, we were able, first of all, to honor all of our contracts with the labor units that we have signed, and I am in support. I think the question here is a salary plan. It's not about the contracts that we have been honoring, but I am in support of a salary plan for all employees for next year. As you know, this is not a campus decision. This is always a system-wide decision, but it has my support and I am advocating for it.
Thank you, Chancellor. The next question may be a joint effort, Dr. Blaisdell and TJ Augustine. The question is, will there be any alternate COVID testing procedures, such as nasal swab, made available for personnel or students who are unable to complete a saliva test due to a medical condition?
Maybe I'll answer that. I would say, yes, there is alternative testing if for some reason someone cannot perform the saliva test. Most people, I think, can, but there are unique circumstances with unique conditions where arrangements can be made through employee health for alternative testing.
Thank you, Dr. Blaisdell. And TJ, you can stay on. The next question's for you. Many of my staff and fellow colleagues have been using their personal resources to perform their work over a year. Is there any advice that can be shared as we return to work and plan for some kind of hybrid work? For example, this is related, TJ, to equipment and computers and policies related to the use of technology on personal PCs, and also practices for e-files and cloud document systems.
So I think the simple answer to this question is our intent is that employees should be able to use university provided computers and to do their work at home. That may have been challenging in certain isolated cases over the last year, but again, our intent has been that employees should make use of the equipment that they were provided by their unit and bring that to their home during the past year. Going forward, we understand that we're going to have new types of working arrangements on campus that involve potentially moving back and forth. Right now, computer equipment the decisions about computer equipment are made by individual units. And it's those same units that will be making the decisions about work from home policies. So we encourage units to keep this in mind as they make their work from home plans, that their employees will need to have the appropriate equipment provided by the university to make those telecommuting arrangements work effectively.
Thank you, TJ. The next question is for Dr. Blaisdell, and if anybody else would like to jump in, please feel free. What are your plans to encourage a diverse student population to accept the COVID-19 vaccine as the best solution to control the current pandemic? And Rex may want to also add to this.
So I would say we're working on this now, and not just with our student population, but with our faculty and our patients as well. We're really trying to make sure that we are getting information to everyone from a diverse population at large. There has been recently some slowing of people anxious to get vaccinated, and we have much more supply. So our work on trying to address hesitancy is really important. We have brought vaccine out into the communities where our students live, some of our faculties live, and also our patients as well. So we not only provide vaccine at the Credit Union One Arena, but we have vaccine sites within the communities throughout Chicago. We've had large-scale offerings in certain neighborhoods. They have been in Inglewood, West Inglewood, back of the yards, and Humboldt Park, and then additional vaccine offering at all of our Miles Square partnerships. So it's been really important to have everyone share their experiences. We have student champions who have been identified to help share their experience on why they've been vaccinated. We have faculty and staff champions to try to share their reason for why they're getting vaccinated. And then we're trying to make information available so we can dispel myths and address any questions or hesitancy about getting vaccinated.
Thank you, Dr. Blaisdell. The next question.
Let me jump into this also, Sherry. I want to express my gratitude to the student government. The undergraduate student government is aligned with us on this issue. They're preparing an outreach. They're preparing a video with the new leaders of the student government going through the Credit Union One Arena. And I think it is important to have this type of support and outreach across the community. Our experience with the general public is that individuals listen to people that they're close to them and people that they know and they trust. I think it's important for all of our faculty and staff to contribute to this effort. Talk to the students that you communicate with about vaccination. They know you, they trust you, they will listen to what you have to say about it. I think that's an approach that it has to be all of us in this effort to try to increase the vaccination rates among our students and of course across the city as well.
Thank you, Chancellor. We'll now ask a question of Michael Ginsberg. Are there plans or programs taking shape to support faculty and staff emotionally and mentally during this time?
Yeah, that's something that we're definitely going to try to expand as much as possible. You know, there is currently on campus the Employee Assistance Program, and I know the Employee Assistance Program is expanding their staffing. There are some links that we have to some resources that are available through employees' health insurance through the state of Illinois Department of Central Management Services, some online webinars and other types of services that are available. But we're also going to be looking at internal resources that we could use on campus that may be available. And hopefully sometime within the next few weeks, we'll be able to have a list of what all those resources are available. But we do think that's definitely something very important.
Thank you. And the next question is for TJ Augustine. TJ, the question is that hours for saliva testing have decreased in recent weeks. And because we're having more people eventually come back to campus, is there a plan to increase the testing hours or remove the requirement for individuals who are needing to be vaccinated? And I think that second part of the question, Dr. Bleasdale may want to jump in on.
Yeah, I think, Dr. Bleasdale may have addressed that sort of already, but I'll pass on that part for right now. In terms of the hours have been reduced recently as we're heading into the summer for the campus. And while we do expect increased activity on campus from individuals who are coming back to more on-campus activity, we also expect other parts of the campus to thin out over the summer, as they always do every year. Right now, we have plenty of capacity at the testing sites. We feel to handle the volume. That said, if the sites become more crowded, because we do have increased demand with more folks coming back, we will absolutely increase hours. Also, we've been working with individual units across the campus. Some examples include the entire hospital, folks in dentistry who have a clinical capability, and building service workers to create sort of specific options for them when the hours don't meet the needs of those units. So if individual units have specific needs, please let us know, and we'll do the best we can to accommodate those.
And I think we talked about it before, but will there be an exemption for those that are fully vaccinated? Again, I just want to highlight that we are continuing to still test those that are vaccinated. The vaccines are highly effective. It is estimated about 95% effective. Of course, that's 95%. So there is about 5% risk still that despite being vaccinated, there's a chance of acquiring COVID-19. And so until we have more information about how well people are protected and the overall decrease of the disease in the community, we will continue to saliva test those that are vaccinated. If we have a significant decline of incidence in the community, there's a chance that we might exempt those that are vaccinated. But that will tell depending on the data.
Dr. Bleasdale, thank you. If you could stay on, the next question is also for you. There's been some news on a third booster dose within 12 months for vaccination. Can you talk about or provide any information on how long vaccination works?
So when there's talk about a booster dose, it's not really related to any failure of the length of protection from the vaccine. It is anticipated that there should be longer immunity protection, but that's still being evaluated. The boosters are really to address the need to cover any variant strains. We know that the current predominant variant strain in the United States is the UK variant, which thankfully the currently available vaccines appear to be effective against this strain. However, the need for a booster will be to cover some of these other variant strains that the vaccines that are available may not be as effective, such as those from the Brazilian variant and the South African variant. And so the anticipated booster is to help to make sure that we are fully protected as there is ongoing transmission globally, and these variant strains can become predominant here in the United States and in Chicago.
Thanks, Dr. Bleasdale. And you're popular today. So the next question is also for you. If someone received their vaccine through another location, is there a way to report these details to UIC?
So we're working on some of the logistics for that. We had anticipated, because when you get vaccinated, especially in the state of Illinois, it goes into the registry. It's called the iCare registry, where actually all of the vaccines are recorded for the state of Illinois. and we have access to that to be able to draw that data. However, we are finding some difficulties with that. So we are trying to develop a mechanism for people to self-report and upload their vaccines from outside of UI Health. So there's more to come on that to be able to notify us of your outside vaccination.
Thank you. And the next question is for Provost Poser. Will the UIC libraries be open to the general public, such as non-UIC affiliated researchers?
You know, that's a very good question. And I just saw that coming up, and I just texted the Dean Ballard Thrower. So I will come back and respond to that. I don't know when they're going to open to the general public. So please come back to me. Thanks.
Sounds good. Thank you. Next question. Actually, this Provost Poser, if you could stay on, we have another question related to clarifying what is expected from those courses that were marked as hybrid. Is it the rotating students in person situation that you mentioned, or can it be a situation in which labs and discussions are in person, but lectures are online for all? I hope you got all that.
I can give it a shot. So if a class has an enrollment of more than 100 students, of 100 students or more, it is online, and it can be synchronous or asynchronous. If a class, and that includes if it's a lecture class, has fewer than 100 students in it, will be offered in a classroom. And this, if it's 100 students, it will probably be, between 25 and 35 students per class time that will have to rotate in and out. And that will depend on the classroom and how it's marked. So I hope that answers the question, but the cutoff is 100 students, whether it's a lecture class or not, for online only.
Thank you. And now we're going to go to John Coronado. This question, John, is about the water safety on campus and whether or not public water fountains have been tested, and how are you handling that?
Sure. So as I said in my remarks, we've been operational pretty much throughout the whole time, and all our maintenance folks and engineers have been operating our systems, our building systems. So they've been exercising the water systems and running them through to make sure that the water does not get stagnant. And in addition to that, we did do some Legionnaire testing to make sure that the water, potable water, was safe. And those test results have come in without any issues. And so we're confident that our water systems and water fountains do have safe water.
Thank you, John. And the next question is for Michael Ginsberg. How is remote work being handled for hourly employees when working over 8 hours per day would trigger overtime pay?
Well, we have to first start with even employees who are working remotely should be working a normal work day. And if they are working overtime, and if that can be determined by and verified by the department and the employee together, then overtime pay is something that does need to be paid for an employee. So it's really something that is a departmental issue, that if the employee is working overtime, it would be no different than when the employees are working on campus as well. There should be some notification that the employee is working overtime and approval granted by the department in order to be able to provide that.
Thank you. And the next question is for the provost. Related to the remote work policy, and Michael Ginsberg mentioned that the policy does not apply to faculty. The question is there a separate policy for faculty about their presence and time on campus?
There is a committee that is meeting to talk about this issue. For the most part, aside from being in the classroom when a class is going on, we really don't monitor faculty coming and going to campus. If a faculty member wants to get excused from teaching live on campus, they would have to go through the accommodation process in the Office of Access and Equity. If there are going to be any other processes aside from that one, that will be coming out of this committee that's been meeting, although I don't know what they're going to come up with.
Okay.
But it will be very limited exceptions.
Thank you. And the next question is for John Coronado. John, how will elevator bottlenecks be handled in buildings like University Hall? Will staircase access be made available from the ground floor?
That's a great question, Sherry. Thank you for asking that. We will rely on kind of self-compliance. We do have signage and floor markings in the elevator lobbies to denote the space, the required spacing in those areas. Where possible, alternate exits and entrances have been identified. But unfortunately, UH is not one of those buildings where the fire exits can be used and accessed from the ground floor to take stairs all the way up. You can access them from above the second floor, I believe. And so that might be a way to do it.
Thank you, John. And the next question is for TJ related to saliva testing. Many K through 12 school systems allow their students and staff to take their saliva tests at home and then drop it off. Has this been considered for UIC?
This is something that has come up. Primarily right now, we've been planning not to change the way we collect our saliva test samples. Reason being, we feel that having people submit the sample in person allows for higher quality for the test, to make sure that the sample isn't sitting around for an unknown period of time prior to the lab processing the sample. We've also had very little issue with lines or wait times. And so right now we're continuing with our current process, but if we find changes to our ability to manage wait times and deal with the flexibility that people need, we will consider this going forward.
Thanks, TJ. And the next question is for the provost again. Has UIC explored the possibility of allowing foreign students to take courses from their home countries?
Well, if they're undergraduate, just our regular undergraduate classes, it is possible that they could watch them synchronously, but that's going to depend on whether they're able to do that and the time of day and so forth. Again, another good reason to record classes. The Office of Global Engagement is working on the issue of students who want to come, who have applied and gotten in or are returning, and are not able to get a visa or for some other reason not able to travel. And they're working on these issues right now. We did have a partnership with Shorelight that created an online program last fall. We are going to probably be running that in the fall with the hopes that we only have to run it for a month or so, and then those students will eventually be able to come over and come to campus. So all of these issues are really in process right now. I will mention that the Office of Global Engagement and Vice Provost Neil McGrillis and Jim Hammerschmidt have been holding open forums for international students about international issues. And you can probably find the next one of those on their website.
Thank you. We also have just another follow-up question for the provost here. Will students who do not want to come to campus be able to take their courses online, or will there be a minimum requirement of in-person attendance to pass the course?
Well, that's a good question. And generally speaking, we are not going to encourage you to force students to come to class on campus. We really believe that they're going to want to come in. Having said that, as I mentioned earlier, there are going to be some classes where faculty are going to require students appear on campus. I know that this is going on with laboratory classes, and it might be going on in the performing arts and music as well. So this is really something that we have to leave up to individual faculty members. If there are students who really can't do it, we would encourage you not to force them to come on campus. On the other hand, if you have 1 or 2 students that have a reason that they really can't come to campus at all, you would use your discretion as to whether to let them do that. So we're setting ground rules here in order to be fully as open as we can possibly have and do this transitional year of being back on campus. But it will be impossible for anybody in my office to police this. And this is just going to have to be worked out at the local level. But we're going to have a problem if all of our students are being given sort of free pass to go home and they all choose to do that. Then we're going to just have to regroup and figure that out.
Thank you. We've had some questions related to how should meal times be handled, particularly for employees who don't have closed private offices. I'm not sure if Dr. Bleasdale or John Coronado want to address that question.
Maybe we'll tag team that. I'll start. I have lots of employees who have to deal with this situation on a daily basis. And what we do is we provide spaces for them to have their meals, and we make sure that the spaces are set up in a way that there's 1 person per table or significant distancing between people's occupying a space. I know conference rooms have been repurposed for meal areas. Other large spaces have been repurposed to serve as meal areas, or in nice weather, people can go outside. But we really, stress to supervisors the need to first create spaces and make sure there's identified spaces for meals to happen, and then making sure that they're done in a safe manner.
I think the other thing is staggering break times and meal times as well too. And so that's what we're doing across the campus, because that's critically the most important time is when you take your mask down, making sure you've got the space to eat safely.
Thanks to both of you. We also have a question for Rex Tolliver. Rex, the question is, how are safety measures being put in place in campus housing?
Thanks, Sherry, and I certainly appreciate the question. One of the great things that we've had for campus housing is the fact that we've operated our campus housing facilities throughout the pandemic. With the safety measures in place, we'll continue to have those, both in terms of spacing as well as having locations or dedicated buildings for both isolation facilities. So I think the staff has had that expertise and will continue to operate that in consultation with both UI Health and Environmental Health and Safety. So those protocols are in place and will continue.
Thank you, Rex. We also have some additional questions related to I believe there are some IT questions specifically about, will there also be available laptops for TAs who teach classes? TJ?
Yes, so teaching assistants are also students. As I mentioned before, the student laptop program and hotspot program has been in place since last spring. It will continue to be in place. And if students of any type for any reason don't have access to the equipment that they need, they should use that program to get the equipment that they do need to complete whatever it is they need to do as a student or a teaching assistant.
Thank you. And I think we have time for maybe one last question here. This is for John Coronado. There's some confusion over the term badging for entering buildings. Could you talk and expand a little bit, John, about the UIC Daily Pass and UIC Health Check, which I think we often commonly refer to as badging, but other folks might not know that terminology.
Sure. Thank you for that follow-up question. So when you complete the UIC Health Check, you typically do that online, and at the end of that, you get an email along, and there's also a link that you can set up on your phone that gets to show your daily pass. And in the fall semester, we started off with just a UIC Health Check and the pass, which is on your mobile device, basically a green check mark saying that you completed the self-attestation appropriately and had no symptoms. beginning in the spring semester, we incorporated what we call the Saliva Pass as part of it and created a dual pass. And the saliva test status is automatically displayed on that badge. And it's a dual badge on your phone that you can pull up and display should anyone ask you, if you've completed the health check and if you're compliant with the saliva test status. If you go back to our Circle Back to Campus from January 26th, there's actually a link that talked extensively about the dual pass system.
Thanks, John. And just to add, we also have that information on today.uic.edu. If you click on the saliva testing button, you can read about the daily pass there as well. And one last question. Sorry, I was wrong. We're going to go back to Provost Poser to answer the question about the libraries.
Yes, so there is there's a fall library planning committee which is looking into this question of when they're going to reopen to the public. That was the question. And they will be reopening somewhat to the public, but the policy has not yet been developed. So stay tuned for that.
Thank you, Susan. We have exhausted our time here today, but we really appreciate everyone's questions. We hope that we have answered the majority of your questions during this hour and a half. And we encourage you to continue to follow the Circle Back to Campus e-newsletter that comes out every Thursday morning with updates, which we'll also be providing on our website. And I'm now going to turn it over to the Chancellor to say a few closing remarks.
Thank you, Sherry, and thank you everyone for coming, and thank you for staying for the entire discussion. Just until a couple of minutes ago, more than 90% of the 1,400 people who joined us in this discussion were still with us. I hope that a number of you share the pride that we all have in the administration team in how we have handled the pandemic so far. As we enter this next phase, the principles will be exactly the same that have guided us over the last 14 months, and I think they will guide us successfully over the next few months as well. Focus on our mission, protect the safety of our students, faculty, and staff, and place our trust in science. Thank you, and I'm looking forward to seeing you on campus.